Welcome to City Life. I'm Beverly Thompson. It is hard to believe, but it's been nearly a year since coronavirus and COVID-19 became household words. Where are we now in Durham, and how can we continue to keep ourselves and others safe? Joining me for a COVID-19 update are Katie Galbraith. She's the co-chair of the Durham Recovery and Renewal Task Force and president of Duke Regional Hospital, and Durham County Health Director Rod Jenkins. Thank you both for joining me today.
Thank you.
Thank you for having me.
So Rod, let's start with you. The number of cases is continuing to go up, but what do those numbers tell us about the spread of the virus in Durham right now?
Well, again, good morning to you. And, to answer your question, at present, Durham is like many areas of the country. We are certainly experiencing a wave that is stress testing our healthcare system. At the onset of the pandemic, we definitely saw older adults with chronic healthcare conditions who contracted the virus. Fortunately, as we've been pleading with our residents, the virus is now most present in those individuals who are 25 to 49 years of age, and it certainly accounts for approximately 47% of our cases. Again, while our Latinx population continues to be overrepresented, COVID is affecting every demographic equally. Simply stated, Beverly, COVID and mass fatigue and outbreaks in congregate settings are still the main culprits of most of our infections in Durham. And, again, much is being said about community spread, but close contacts still account for about 48% of all of our new infections. As far as statistics, we always look at the 7-day moving average because that always lets us know, how big the infections are going or how small or decreasing. And our 7-day moving average for the past couple of months have been anywhere from 80 to 95, which is indicative of the surge. So my recommendation to residents remains the same. Remain home as much as possible. If you do have to go out, just wear your face coverings and social distance wherever possible.
Mm-hmm. So the big hope now is that the vaccine is going to work the miracle to help us get past this pandemic. It's on its way. And do you have any idea or any thoughts about how it's going to be distributed in Durham? And what would be the health department's role in that?
Local health departments and hospitals will play a major role in vaccine distribution. We are set to receive direct shipments of vaccine from the manufacturer. I know in conversations with Katie, she has indicated that Duke is ready. Of course, they're always ready. They did receive some coverage in the media, which is very helpful for our residents of Durham. Per the state and CDC and ACIP orders, specific groups will be required to receive it first in 4 phases. We still are delighted to know that in phase 1A, of course, going to be our frontline workers who have been, really impacted by COVID-19's infections, particularly those valued teammates in hospitals. Katie sees it every day. And so doctors, nurses, and healthcare workers will receive it first. And then, of course, staff and residents in nursing care facilities will receive it along with, our employees with public health. Durham County Public Health has been really, really busy working with a number of partners to include Durham Emergency Management, Duke's Emergency Management, Fire and Rescue, EMS, you name it, we're working with it. And we're certainly confident that we'll be able to distribute the vaccine efficiently and most importantly in an equitable manner.
Mm-hmm. And Katie, could you talk just a little bit about the hospital's role in distributing the vaccine, not just to employees, healthcare workers, but to the public?
Absolutely. So, we've been planning for this for a few months now, and so we are prepared, starting with our own team members and that vaccination early on. Of course, starting as Rod said, really with those who are most at risk for exposure to COVID due to their role in the hospital. So starting with our team members who are caring for patients on our COVID units in our emergency departments and our respiratory care centers, and then moving beyond that to certainly the broader healthcare community and then the broader community as well.
Okay, thank you for that. Katie, you and Rod are members. In fact, you're the chair of the Durham Recovery and Renewal Task Force. Can you please remind everybody what the task force is all about?
Absolutely. This is a great task force that was appointed by Mayor Schewel and Commissioner Chair Jacobs back in May, really to help advise them and provide guidance on how to safely and successfully keep our community running during this really challenging time. It includes, it's a 16 member task force that includes public health experts. It includes business leaders, community leaders, faith leaders, as well as representatives from the county's emergency operations center. So it's a really dedicated group of leaders, and has been a real privilege to work and serve with them.
So, Rod, from a public health standpoint, you guys have accomplished a lot. I know that. You've definitely kicked off the Back on the Bull campaign. Have you completed your work? I mean, why is the task force still needed at this point?
Well, again, as Katie has said, I've enjoyed being a member of the task force, and its members have definitely become an extension of my own team. And like I tend to say, kind of corny at times, but they've been public health champions, truly. Given that they represent many important sectors of Durham, I'm able to articulate the finer points of our overall response to the members of the task force. I think the most important thing that came out of the task force, Beverly, is the roundtables. They've truly become a vital part of the task force's messaging, and has helped us to really send that message to the masses, enabled us to really explain, why the measures we're taking to safeguard our residents. All of these efforts have truly been critical in, our plans to distribute vaccines, our public health messaging about 3 Ws. And then, of course, they made, some of the members of the roundtables and the different roundtables have industry-specific questions that we've been able to answer for them as well. But again, being able to, provide updates on the where, the why, the when, and how helps us to get the work done.
Okay. Katie, we're in the middle of the winter of both the flu and COVID in full swing. From your healthcare perspective, how are we positioned to handle all of this right now?
Yeah, great question. So first of all, I would say I am so incredibly proud of our Durham community. This community has really embraced the very simple public health guidelines of wearing your mask, washing your hands, staying 6 feet apart, and maintaining vigilance during this time is really essential to helping us continue to stem the tide of this really deadly virus. I'm also really proud of our healthcare heroes. They are providing extraordinary care to our community through really challenging circumstances. From a healthcare perspective, I would say we've learned a lot since last March, when we had our first case diagnosed in Durham, and we are very well prepared. We're well prepared for an influx of COVID patients. We're well prepared for flu season, and our top priority throughout all of this, though, remains reinforcing those really simple things that each one of us can do that really make a difference. I can't say it enough. I sound like a broken record, but very simple: wear your mask, wash your hands, stay 6 feet apart. Even though we're getting tired of those things, we have to keep reinforcing them.
Mm-hmm. So, Rod, what is the health department's job in all of this right now?
I think Katie said it best. Public health's role is multifaceted, but our main objective is real simple: to really trumpet the simple public health message. With this deadly respiratory pathogen that we have, those 3 simple public health measures are all that we have At present, of course, we know COVID vaccines are certainly on the way, but again, just making sure that we continue to message the 3 Ws is definitely number one on our list. And again, as Katie mentioned, we started to promote COVID testing and also getting flu shots, particularly flu shots. That's something that we do every year. But especially proud of the Durham community. One thing that Katie did not say is that we were so far ahead as far as our flu vaccinations that, it's just remarkable. So we are able to monitor flu and COVID surveillance, and we're doing well in flu due to, all of our emphasis on the 3 Ws, because again, that's a tried and true public health mitigation strategy. Mm-hmm. I would say around this time is when we experienced the peak of flu season, but I will say so far so good.
Good. That's good to hear. But given all of this, what do you still see as your biggest challenge in accomplishing everything that we need to do right now?
Without a doubt, our biggest hurdle in doing all that we do is dispelling rumors and misconceptions. It's really about getting people to embrace the science. Flu vaccines are in abundance. There's no shortage of it. Of course, COVID vaccines are going to be in abundance as the weeks progress throughout 2021. The COVID vaccine will be available in large quantities. Simply getting people to embrace both will always be challenging, but I have faith in Durham. I do know that Durham stands tall, and so far so good. We've really done well with the pandemic compared to other like-sized counties and like-sized areas. And I have no doubt that we'll continue to stand tall.
Great. So, Katie, in addition to the task force's advisory role, you all have been charged with implementing a number of your recommendations. And of course, one of them is the Back on the Bull campaign. Remind us why that is and why it's still needed.
Absolutely. So the Back on the Bull campaign has been a fabulous partnership under guidance from the Recovery and Renewal Task Force, but really in partnership with McKinney, which is a creative services firm, as well as the Center for Advanced Hindsight at Duke University. And it's designed to really help slow the spread of COVID using public health, behavioral science, all of those best practices. Mm-hmm. It was originally designed to help provide consumers and business owners, as well as our employees, with the needed information about how to reopen safely. And now it's helping them to stay open through this. So the campaign includes a voluntary self-certification tool for businesses. And it's also a website, and there's been a media campaign behind it as well. So again, reinforcing public health best practices, reinforcing what businesses need to do to be able to operate safely, and then also over time restoring confidence in the public in being able to safely begin to go back to those businesses.
Mm-hmm. So I know when the campaign was launched, businesses were trying to recover just from being, shut down over a few months. So at this point, is it safe to say that we've moved from getting back on the bull to trying to stay on the bull?
That's probably a good analogy there. I think we all are really concerned for our businesses. This pandemic has had a really devastating impact on businesses, especially our smaller businesses, our restaurants, hospitality industry in particular. Mm-hmm. And so as a task force, we've really shifted our focus from the immediate public health crisis, although we still remain vigilant there, but really focusing on the longer term economic recovery for Durham. And so in addition to the Back on the Bull campaign, I would say the city and the county have provided funding for health ambassadors to really work with our businesses. And they've also provided funding for small grants for businesses. So for those small businesses to really help support them through what we know are incredibly challenging times.
Oh, yes. Mm-hmm. So, Rod, we know that the Latinx community has been from the very beginning slightly overrepresented in COVID cases, but not as significantly as it was earlier in the summer. What has happened to change that?
Simply stated, Beverly, lots of hard work. I couldn't be more proud of the work that was done with our Latinx population. midsummer of last year, they represented anywhere from 78 to close to 80% of all of our new cases at the height of that second surge. The work with our Latinx healthcare advocates has helped us tremendously. Groups like El Centro Hispano, the Lat19 Healthcare Awareness Coalition, LaLey Radio Station, and many others really stepped up their efforts in assistance. And then, of course, we had a heightened awareness from our city, county, and state leadership that really helped and emphasized the need for this demographic to really pay attention and to understand COVID's impact. My team and I, of course, I can't really emphasize how proud I am of my team. We work really hard to translate a lot of our important messages and statistics in Spanish. And we certainly ensured that our data hub, which is, pretty much our crown jewel of information sharing, was available in Spanish as well. But our entire community should be proud, but we certainly have much more work to do.
Mm-hmm. So I know COVID fatigue is a thing and people are, just tapped out. What precautions or steps can everyone take at this point to continue to protect themselves and their loved ones?
Again, I just remind people at every turn, remain at home as much as possible. Again, continue to stay behind the mask and wear it properly. Again, over your nose, under your chin, not sagging, not nose out. Just making sure you wear it properly, washing your hands and practicing social distancing. But more importantly, Beverly, never give in to COVID fatigue. COVID-19 is a deadly respiratory pathogen that is currently killing 2 U.S. citizens per minute. Wow. So again, sometimes you need to really let people know the current state of affairs. COVID-19 is just deadly, and you cannot get COVID.
Mm-hmm. So, Katie, I know in the beginning, the task force had a number of roundtables focusing on many different aspects of life and the community in Durham. Has the need for those tapered off any, and which ones are still a strong area of focus?
Yeah, great question. As Rod mentioned earlier, the roundtables have really been an important part of the task force's work. And this has allowed us to engage far more than the 15 core members or 16 core members of our task force to really engage hundreds of leaders from across the community. Mm-hmm. The cadence of the meetings has changed a little bit. Those task or roundtables we're meeting, every week, sometimes a couple of times a week in the very beginning. That cadence of meetings has tapered off, but the work is still ongoing, especially for our economic recovery roundtable, our restaurant roundtable, our vulnerable populations and immigrant and refugee roundtables, our faith leaders, and our education roundtables. So still a tremendous amount of work to be done, and we really rely very heavily on them to really help us.
Mm-hmm. Before we leave, I wanted to get back to COVID fatigue. What do you all say to your colleagues, your friends, and loved ones who are just over it at this point, and we just want to get back to normal? What do you say to them? Your own family. What do you tell them?
Yeah, I think COVID fatigue is real. I suffer from COVID fatigue. I think we all do, and so I understand it. But I would say we just cannot let up. We are so close. There is hope on the horizon with this vaccine. We are there. We have been through 9 months of this, and we just need to hang on for the next few months to get to the point where we can really begin more broadly vaccinating this community. And so, we just can't let up. We have to keep taking responsibility for making those really simple decisions, like every time I'm out in public, I'm wearing that mask. Mm-hmm. Every time I'm outside of my office with the door closed, I am wearing my mask. I'm always washing my hands. I am really vigilant about washing my hands and avoiding large gatherings and staying 6 feet apart. So it's really simple. We are not out of the woods, and we just can't let our guard down. That's what I tell my loved ones.
Rod, what about you?
I echo Katie's sentiments. I am sick of it too. I'm a health director. Public health is my life. I'm sick of it. As Katie said, vaccines are on the way to being in wide distribution. But even with it, we still have to practice those 3 W's. I would just say, I always say to my family and my loved ones, don't let up, no, let your guard down. And for those loved ones and friends who, I kind of see slacking off, I just ask them, recommit to keeping yourselves and your loved ones safe.
Mm-hmm. Okay. Is there anything else either of you would like to add?
So I would just
great messages here. I'm sorry.
No, I would just love to thank the Durham community. I really want to thank everyone in Durham who has been so committed, who is working through COVID fatigue, because again, we recognize that is a challenge for everyone. But Durham has been really committed. I want to thank our city and county leaders, our task force members who have been just incredible in dedicating their time. Our health department colleagues, again, just amazing. And then everyone on the front lines. They inspire us every day with their courage, their professionalism, their resilience through this. And so really just a huge thank you.
Mm-hmm. Rod?
Katie summed it up so eloquently. I express gratitude to each and every one of those groups that she listed. I know I'm new to Durham, but I think I said it best a couple of months ago. I believe in Durham, and Durham has certainly made me a believer. And the thing I will say is that one day soon we'll look back on all of this and just smile. We'll just smile and say we made it through. And it's important for us to just remember that one day, eventually this will all go away. But until then, we just have to remain vigilant.
And on that day, I'd love to have you both back and we can talk about how we made it through and what the bigger picture ahead is. Thank you both for joining me. I really appreciate it.
And we can talk in person then. That will be the beauty. So
definitely. I can't wait. Well, that does it for City Life. Don't forget to follow us on social media and watch us on Durham Television Network and on YouTube. And you can listen to our podcast on iTunes. I'm Beverly Thompson. Thank you for joining me to learn more about city life in Durham.